Welcome to an overview of the School Care Yellow with Choice Fund 2.0 plan. This webinar will review the features and benefits of this plan. All school care plans provide the same coverage, meaning what the plan covers for doctors, treatments, and medications is the same. The plan uses Cigna's national open access provider network across all 50 states. The open access feature allows participants to self-refer to see a specialist and does not require you to name a PCP. Preventive care and certain generic drugs are covered at no cost. The Yellow Plan with Choice Fund 2.0 has a deductible. A deductible is the first portion of coverage that is paid by the insured at 100% of the Cigna contracted cost. Once the deductible is met, you still have some potential out-of-pocket in the form of coinsurance. During the coinsurance phase, the plan pays the majority of the cost with 80% coverage for medical services and 90% of the cost of a prescription, capping at $75 per prescription. The out-of-pocket maximum is the most you would ever pay out-of-pocket in any plan year. The out-of-pocket maximum is the sum of the deductible and the coinsurance amounts. Aside from preventive care and certain generic medications, all other covered medical services and prescription drugs apply to the deductible, then coinsurance up to the out-of-pocket maximum. Once the out-of-pocket maximum is met, all covered medical services and prescriptions are covered at 100% by the plan for the remainder of the plan year. The Choice Fund is an Embedded Health Reimbursement Account, or HRA. To activate the account, subscribers must complete a confidential health assessment. Current Cigna subscribers must complete it between July 1st and August 31st each year. New subscribers must complete it within 60 days of their effective date. Providing biometric information is not required, but it is recommended that you know your numbers. By activating the Choice Fund, School Care will provide $1,000 for individual coverage and $2,000 for two-person and family coverage to pay the first part of the deductible automatically. Any unused Choice Funds will roll over into the next plan year and can accumulate up to the out-of-pocket maximum. Let's review further the details of the plan. The plan uses Cigna's national open access provider network. Preventive care is no cost. The Choice Fund will pay $1,000 or $2,000 towards the annual deductible if the subscriber completes the health assessment at myCigna. The deductible is $1,500 for single coverage and $3,000 for two-person or family coverage. After meeting the deductible, you will pay 20% of medical charges and 10% of the cost of a prescription, but no more than $75, up to the annual out-of-pocket max. The out-of-pocket max is $3,000 for single coverage and $6,000 for two-person or family coverage. This leaves you with a net out-of-pocket cost of $2,000 for single coverage and $4,000 for two-person and family coverage. All medical services accumulate to this equation, including doctor visits, telehealth, and behavioral health visits. It also includes emergency room, urgent care visits worldwide, tests, labs, and hospitalizations. You have 60 combined visits for speech, physical, and occupational therapy. You have 20 visits for chiro and 12 visits for acupuncture. Durable medical equipment, including hearing aids, insulin pumps, CPAP machines, all accumulate towards your out-of-pocket maximum. Prescriptions apply as well to this equation, and after meeting your deductible, you will only pay 10%, but no more than $75 for the cost of a medication. Let's illustrate how this works for an individual. The deductible is $1,500. By completing the health assessment at myCigna, it activates the Choice Fund of $1,000. That's going to pay first towards any deductible expenses, whether it's an office visit or a trip to the pharmacy for a prescription. Once the $1,000 choice fund has been used, the individual is responsible for $500 of deductible expenses. Then, when $1,500 has been met, you've reached the deductible and now coinsurance starts. You will only pay 20% of medical claims, 10% of the cost of a prescription, but no more than $75, until a total expenditure of $3,000 has been reached. The first $1,000 has been paid by the choice fund, and then $2,000 has been paid by the individual. From that point on, all services will be covered at 100%. Now, let's look at two-person and family coverage. Two-person and family coverage have a $3,000 deductible. The subscriber completes the health assessment at myCigna.com to activate the $2,000 choice fund. That $2,000 fund will pay the first portion of deductible expenses for any member of the family, whether it's a trip to the doctor or a medical service or a prescription. Once the $2,000 fund has been used, then the family will incur $1,000 of deductible expenses out of their pocket to reach the $3,000 deductible. At that point, coinsurance charges apply. You will pay 20% medical charges and 10% of the cost of a prescription, but no more than $75, for potentially an additional $3,000 until the family's expenditure reaches a total of $6,000. The first $2,000 having been paid out by the fund, and then the $4,000 being paid by the insured. Again, after that amount has been reached, all services are covered in full for the rest of the year, including prescriptions. myCigna makes it easy to keep track of all your transactions. First, you can log on to myCigna.com and complete the health assessment. You can also click on Claims and Balances to review all the transactions for your family's medical services and prescriptions. You can also call Cigna 24/7, 365 and speak with a phone representative for questions and customer service issues. And lastly, Cigna has a mobile app that you can download to your smartphone and have all the information at your fingertips, including downloading or printing a digital ID card. The School Care website, schoolcare.org, is a great resource for plan documents, resources, and other information, including details about the Good For You well-being program. This concludes the webinar. Thank you for watching.